Hi everyone, Shanna and Karen here from Certified RN. We are doing our questions today and we are working on question number 8. I'm going to read the question and then Karen is going to go over it and discuss it with us. Ideally, you would want to read the question below and then answer it yourself. Of course, pause the video so you can kind of think through it and then resume the video as Karen gives us the answer. So let's get started. I'm going to read question number 8 right from my phone here. Okay, question number 8. You are administering losartan to your patient admitted with heart failure with reduced ejection fraction. The goals of angiotensin receptor blockers, an ARB, in the treatment of heart failure, little r, EF, are 2, and we've got 4 choices there. So Karen, first, before we go over the choices, can you just talk about the heart failure with that little r and the E and the F?
Absolutely. So there's 2 kinds of heart failure that you're going to want to know about. And one is heart failure with preserved ejection fraction, what's the P, and then heart failure with reduced ejection fraction. And so this is a patient who has reduced ejection fraction. And so that basically means that they don't have a very good pump. So systole is not very strong, okay? A normal ejection fraction is like 58 to 75. And so when you have reduced ejection fraction, they're usually talking under 40%. So that would be usually what they're thinking of for somebody who has reduced ejection fraction. It would be under 40%.
Perfect. Okay. Thanks for that clarification.
Yes. And so we're going to go on and look at this and see what we want. So let's just for fun, let's just start at the bottom. Let's look at D, and we're going to just do process of elimination. How about that? So we have improved vascular tone. Well, that when you think about vascular tone, that means like tighten things up. So probably not good in a heart failure patient. Also, another one is we don't want to increase ventricular modeling. We want to decrease.
Yeah.
We X out D. D is gone. C, vasodilatation is great, but increasing afterload, not in a heart failure patient. We wouldn't want to increase afterload. So that's going to be wrong too. And then let's look at number B, decrease preload. Well, the interesting thing is the ACE inhibitors and the ARBs, which is the angiotensin receptor blockers, they do not affect preload directly. So that's not the best answer. And then increased contractility, they do not do that. That's not their job. You might end up with better contractility because of some of the other features of the medicine, but it doesn't directly do that like dopamine or dobutamine or something like that. So now we got to A, and A says reduce sodium and water retention. Absolutely, that's what they do. Decrease ventricular remodeling, preserve renal function, and decrease morbidity and mortality. So the ACEs and ARBs do all of those things. So that's going to be great for a heart failure patient. Remember the renin, angiotensin, aldosterone cascade that can occur? That's what we're controlling with ACEs and ARBs. And so almost all heart failure patients, particularly if their ejection fraction is low, will be on either an ACE or an ARB. Okay?
Yep, got it. That's such a good review too, because like it's easy to confuse those things. So being able to separate those out and understand, because yeah, you have these heart failure patients and sometimes they're taking all kinds of different medicines, and then you're like, oh, which one is for which?
Exactly. And I like to group the ACEs and the ARBs together because they basically do the same thing. They act just a little bit differently, but they do the same thing. And just to remind you what they do is they stop that angiotensin 2, that powerful vasoconstrictor. They stop that. And so that's really their jobs. That's what they do. And they have those wonderful benefits there.
Yeah, no, awesome. All right, well, thank you so much. That was great. And everyone else, just so you know, we have plenty of more questions that you can follow along with us. I hope you join us in the next question. Bye.
Bye.